My name is Daniel Filder and I've been part of the steering group AIM.
Hello, my name is Ayra and I've also been part of AIM. AIM stands for Adolescent Interventions for Mental Health Services. And today we'll be talking about youth depression, and we are joined by Miranda. Miranda, can you introduce yourself straight, please?
Sure. So my name is Miranda Arieh and I'm founder of HEROES program. HEROES stands for Healing, Education and Recovery of Emotional Strength, and we're a service that's currently expanding through the NHS.
To start off with, how would you define depression in young people? And does this look the same for those aged 10 to 19 and those 19-year-old and above?
I guess I would define depression not as an illness in itself. I would describe it as a symptom of a deeper wound. So a lot of the mental health labels to me have come to mean have come to signify symptoms of a deeper issue. And I know for me, like having, I got diagnosed with many different things under the sun. When I was an adolescent, I got sectioned under the Mental Health Act, and I lived in an adolescent psychiatric unit for quite a significant amount of time as a teenager, in and out of the care system. And for me, depression at the age of 14, 15 did look quite different to how it did when I was a bit older. And I guess that with depression, on a clinical level, I guess, which I'm not clinical, but I know that it stands for something which has been lasting and sustained for over 2 weeks. So, a lot of people go, I feel depressed today. But depression is longer than that. It's symptoms that are showing up for over 2 weeks. And it may look like a withdrawal from life, I would say, in my own experience, and very much a loss of interest or engagement in joy or being able to engage with the world effectively. I know that's how that's shown up for me and for a lot of the young people I've worked with. Withdrawal can appear in many different ways, and withdrawal is a need to tap out of rather than lean into emotional experiences, and there's a big difference there. Tapping out of emotional experiences can go as far as numbing out with drugs and alcohol, or it can simply be endless scrolling, just zoning out. But it's like an inability to come into contact with that deeper wound, I would say, with depression.
Yeah. See, in our recent group, the discussions we've been having is that we've identified things like overthinking, the future, lack of purpose, and isolation as causes of depression. And just from your experience and what you've said so far, how accurate would you actually think, Isabel, how accurate would you say this is?
I would say the cause goes deeper than that.
Yeah.
I would say that there's a reason behind why people would isolate in the first place. Because a lot of the time, for me, when I've looked at the wider mental health system as a whole, and from my experience in it as a patient and service provider now, I think we have a real issue when we look at saying that person has lack of purpose, that's what's caused the depression. That person is isolated, that's what caused the depression. I feel like we have to strip back even deeper and go, what has caused them to want to isolate? What has caused them to have that lack of purpose? And on a deeper level than that, I would say that always comes from, in my experience, and it might sound a bit radical, but in my experience, I'd say it always comes from a belief system that person has about themselves, others, and the world around them, which has been created in developmental years.
You don't think it can be naturally inherited?
I do believe it can be inherited, and there's this wider question, isn't there, around like nature versus nurture. Like, are people born with, predisposed to mental health issues? And it's a really good question. But I would say that where a parent has had mental health difficulties, it's always going to be quite hard to say whether that's just passed down genetically or whether that parent might not have had capacity to be attuned to that child's emotional needs. And then that's caused that belief system in the child. It passes down in many, many different ways. And there's intergenerational trauma, which is a whole bigger topic, which we probably won't tap into today. But But I don't believe it's ever as simple as just like you're born with that mental health condition. No, I don't personally believe that.
Yeah.
So would you say it can be, but it also requires almost a trigger, you know, as they're growing up, or, you know, in the younger years, like it might be inherited, but for it to actually cause depression or for them to actually have some sort of mental health problem, there needs to be some sort of trigger. Is that what you would say?
Yeah, well, I'd say like our triggers, we all have very unique triggers because we all respond very differently to different situations in this life. And the triggers that we have are based around the wound that we carry with us as a response to difficult experiences in our lives. And, you know, as young people developing, every single one of us has, I'd say, two main drives when we're developing in the world, when we're young.
Yeah.
As human beings, we have two main drives, and all our needs can fit into these two drives. And these drives are one for survival and one for connection. Okay? Survival, we might see as how safe am I? We might see that young person asking, navigating the world, asking, even if they can't speak yet, learning, how do I make sure I'm safe? And then on the other side, connection-wise, we might see that child asking, how do I know I'm loved? How safe am I? How loved am I?
Yeah.
Okay? And then we create our entire belief system and our nervous system as one. The mind and nervous system, for me, they're one. The nervous system's completely connected to the brain. So it's with the mind, body. We have to look at the whole of us when we're treating trauma or conditioning. And I would say that we then navigate the world with a belief system set up around making sure we're safe and loved and connected. And then the wound, trauma is not what happened to us. Trauma is what we made, you know, those things that happened to us mean for us. So I see trauma as a living, breathing wound. Trauma or difficult conditioning is a living, breathing wound that can open in the present moment in accordance with triggers.
Yeah.
And it shows up a belief system.
Yeah.
But I would say it always comes from somewhere. It doesn't always have to come from even caregivers, but society as a whole.
I think, yeah.
School, we all have a belief system, and our triggers are all unique to our own belief system.
Yeah, definitely.
So linking back to the belief system, do you think that family plays a part in how a child feels? Just a family overall?
100%. Yeah, 100%. Because as children, we're hardwired for connection. And, you know, yeah.
Just to say, what if the child prefers to be alone?
Yeah. And that child might prefer to be alone. And it's whether that aloneness is them moving towards comfort and a feeling of safety, or running away because they're afraid. And there's a big difference between the two. If that child is trying to escape something and they want to shut away, shut down, like we said before, you know, or are they moving just towards comfort because there might be sensory overload, there might be neurodivergence in there, etc. But really, as children, you know, if we see we're navigating the world, asking those questions, how safe am I? How loved am I? How do I make sure that I feel safe? How do I make sure that I stay connected? Then we might almost start to see trauma as an adaptation, a modification, a step away from authenticity as a child then looks to the world to make sure they're safe and loved. And sometimes that involves us abandoning ourselves in the process. In childhood, parents don't always... Trauma is not always something that's happened to somebody.
Yeah.
Trauma is sometimes the absence of those core needs being met.
In our youth group, we went over scenarios where young people seemed like they were fine, but in reality they weren't. So we just wanted to ask, what type of symptoms and signs do you think parents should be aware of to ensure that their children don't have depression or they're feeling a certain way?
Great question. I think as parents and as teachers, we have a responsibility to invite and welcome the authenticity of our kids. We are having an absolute crisis in the world right now around people feeling they need to modify who they are, what they want, how they show up, how they talk, how they walk into a room, modify and adapt rather than just be themselves. And that's all that's required of us in healing. The healing work is about coming back to authenticity. We have to, as parents, allow our children to be them so that we can listen. We have to, particularly when we're looking at youth, we're talking about those teenage years, we have to not take things personally as well. As parents, I've got an 18-year-old daughter myself, so I've been through the whole journey of parenting. I would say that some of the biggest practice for me, practice of presence, was when she turned into a teenager and everything came true that I'd seen at the fair. Oh my God, suddenly this, like, what the hell? Was my ability to stay present and not take it personally, not go into firefighting myself, not attack, not criticize, not judge, not punish, but to ask the question, are you all right? I'm here when you need me. Okay. I mean, we be consistent, we be loving, we don't take their behavior personally, and we invite them again and again and again to be them. We do not put our judgments or preconceptions of who they need to be on them. We allow them to be them. And this is what's going to bring a happy child, not making them live up to our expectations or what we want for them. We listen. We have to listen. And it can be really hard, as a parent. I know it's really, really hard, but it's the most beautiful thing we can do is bringing up a happy, confident child. The difficulty occurs when we look at children. If as a child in our developmental years, we are not loved for who we are, but instead we're loved for what we do, how we behave, how we please others, how useful we are, that child will not grow up feeling it's safe to be themselves. They will grow up asking the question, who do I need to be accepted by you? So it's a complete disconnection from the self. How do I need to show up and navigate this world to make sure I can relate to others? And it's a big thing that we do see with neurodivergence, particularly women, or autistic women, which is a journey I've been on recently.
We've touched upon before, some of the causes, but why is it important to look at depression not just as an individual issue, but as one connected to broader life circumstances like education pressure or digital life?
Yeah, I think it's extremely important to see it as totally linked in with society, with the education system, with the way that society is set up and the way that trauma is perceived in the healthcare system as well, which we're moving towards a lot more like a trauma-informed holistic model. But yeah, I mean, depression is a human issue. It's not an issue of that individual. And, while the cause is not always people going on the phones, etc., there is a lot that needs to be done around interventions set up to support people who are maybe withdrawing due to pressures at school, demands. For me, it needs to be really embedded into the curriculum, emotional health work, like solid emotional health work. I feel like if we can train robustly young people in methods to work with their suffering, I feel like that's crime prevention, that's depression prevention, is tooling people up. And I feel like that might have got a bit lost in the educational system. There's like tokenistic classes that happen, but I feel like what needs to interweave everything is about mental health, and mental health is a society issue.
Yeah. So do you think it's important to sort of bring it into schools and really tackle it personally within the school system and just education overall?
Absolutely. And in line with making sure that schools are trauma informed and that that the teachers are trained up with skills to make sure that they're able to engage effectively with kids or young people that may be suffering with mental health. I feel like neurodivergence education is extremely important too, because a lot of the people I've seen, and myself included, who were diagnosed with neurodivergence a lot later on in life, a lot of the issues I had were not picked up at all.
Yeah.
And it could have led to me staying at a hospital if I would have had the specialist support I needed with my own neurodivergence.
Yes.
Yeah.
So do you believe if it was a subject in school, like many more people would not be affected by mental health?
I really do, yeah. And, you know, I think a lot of the time I see systems and you know, within my experience of living within the mental health system for quite a long time, I just saw endless firefighting, which was all around trying to put a plaster on the wound. So if we talk about trauma being that living, breathing wound that we carry with us, it's not just something that happened in the past. What I saw in the system was very much about the system trying to apply a plaster to the wound.
Yeah.
Medication,
Yeah.
hospitalization, deco injections, send them to therapy later in life, work these treatments, trying to fix, get rid of the anxiety, get rid of the depression, stop it.
I think also that the little bit of security plays a massive part in their future. Just knowing that you care about them, such as the little thing saying like, "Oh, how are you?" and stuff.
Oh God, yeah.
They'll acknowledge that and they'll keep it.
Yeah.
So true.
Yeah.
That's such a beautiful way of putting it, Daniel, as well, because that, what you've just described, is pure attunement to a child.
Yeah.
Yeah.
We need to be attuned to their emotional experience. That doesn't mean we have to make them happy or fix anything, because we want to avoid that actually when we're working with someone who's suffering in any way or coming up with it to us with an emotional experience, whether they're our child or friend or whatever. But that, just checking in, how are you doing? Showing that interest. How are you doing at the moment? What's going on for you? Showing that interest is ultimate parental attunement. It's really powerful.
Yeah.
There's little things.
Yeah.
Very, very
Yeah,
powerful.
because a lot of children do feel like they're just not being heard. And I think that's a massive thing with the youth especially. So just a simple question can really just make a massive difference. And just following on from that, our youth group has actually tackled some common myths that, you know, relate to depression. So for example, people saying you can snap out of depression. And how can such statements actually cause more harm in your experience?
Yeah, well, it's very, very helpful, because something like, you know, when you're living with depression, depressed mood or anxiety, you know, symptoms of that deeper issue around your wound, when people say stuff like you can just snap out of it, it causes so much shame.
Yeah.
And shame is fundamentally the heaviest emotion in my experience. Shame is a belief that something is fundamentally wrong about me.
Yeah.
And walking the world in that identity is very painful and it is very harmful. We have to look at meeting someone where they're at. And it doesn't mean that we support them to dwell in that low mood, but it means that we, you know, one of my favorite teachers, Brené Brown, she talks about the idea of empathy, not being that we jump down into that well with somebody, but it's that we just reach a hand out to them. We have to meet someone where they're at without trying to fix or say they should be some other way than they are. That's not presence. Presence is being, okay, so that's where you're at right now.
Yeah.
Tell me about it.
Yeah.
Okay, I'll be this space where you can open up to me. Tell me about it instead of, you know, you shouldn't really, because snap out of that is very much, you shouldn't be feeling that way.
Exactly.
And, you know, shame not only comes from others saying that to us when we're struggling with our mental health, but also it creates stories in ourselves. You know, we've all had it where it's like, I shouldn't be feeling this way. I shouldn't be feeling this anxious. You know, it's not healthy. It's very toxic to speak that way to ourselves or to others.
Yeah.
What would be your advice to someone who feels ashamed and afraid to ask for help?
First of all, I would say the fear might feel really, really valid, and I'd really honour that it can feel extremely frightening to ask for help, particularly when we're in that low vibrating state, because we're seeing ourselves as maybe not worthy. We're seeing ourselves through that lens of shame. So I'd first of all honour that can feel really challenging. And second of all, I would say that you are never truly alone with how you feel, ever. And that thought, that thought of just imagining there were lots of other people, because it's a very human experience, going through a similar human experience can sometimes support a feeling of connection over disconnection. And once we commence that process, I would say it's essential. It's absolutely essential on your healing journey to start to express how you're feeling. If there is not someone in your life that you feel comfortable sharing with for whatever reason, or there's no one that you feel like you could trust, there are always helplines there. Samaritans is one I can think of off the top of my head, 116, 123. There are hundreds of different helplines. Please speak to somebody. A lot of people are under the illusion that helplines for mental health, like Samaritans, etc., are specific for if you're ready to commit suicide. A lot of people think, oh, I'm not feeling bad enough. Or what I would say is they are there as a prevention. Yeah. Speak to somebody, express it, even if you need to do it anonymously. We don't effectively, as human beings, process emotions until we express them in some way. For some people, that might be through art. Some people, that might be through writing lyrics or poems or journaling. But for most people, from what I've seen, it's that verbalizing, I'm not okay.
Yeah.
Okay.
Yeah. Yeah. So how do you think we can make services more accessible and youth-friendly?
I think they have to be pitched right, don't they?
Yeah.
They have to be pitched right. And, I feel like we're living in a very exciting time for mental health care, in all honesty. And, even if you look on like the socials, there's endless reels about like trauma, neurodivergence. There are lots of people speaking out about mental health. I love it. It's just fantastic. I feel like mental health services can really play on this bandwagon, which is all around. I feel like we have to shift looking after our mental health and doing the deeper work to heal. And we have to make it look cool, because it is. Yeah. It's an amazing journey to be on. It's wonderful living life on a journey of personal development, of personal growth, on shifting the way we see ourselves, which might be built from difficult developmental conditioning, shifting our identity, knowing that we can achieve more, knowing that every single one of us here put on this earth is here to elevate and expand, and that the difficult things that happen to us are all opportunities for overcoming. When we step onto that path, living life in that healing journey, like I do, and like lots of our people who've been through Heroes program now do, it's an incredible way to live life. It's such an incredible way to live life. So I feel like the reframing of mental health care, classing it as something like, this is an amazing journey to be on, learning, developing, healing, learning to see our triggers differently, using them as opportunities. I feel like it needs to be framed differently than just like, you're ill, you need fixing, go on the waiting list.
Would you say it's definitely moving in a positive direction compared to what it used to be?
Absolutely. Night and day. It's night and day. It's phenomenal. This is the most exciting time for mental health care that I've ever experienced. And I've been in mental health care since I was a child. I've seen it evolve from both sides of my entire life in the mental health system in one way or another.
Yeah.
Decades. And right now, it's phenomenal. We are on the cusp of something very, very exciting for mental health care, and it's viewing trauma in a very different way. And we're breaking down those barriers. The system is becoming more trauma informed. I mean, what a time to be alive, I would say.
I think it was always projecting, but then when lockdown struck, I think that's when it plummeted a bit, because there was really access to nothing apart from being online.
Yeah.
And in some cases, being online wasn't very good for some people. So
totally agree, yeah. And, we do have a really big issue in the mental health system around staff being under-resourced. Waiting lists have waiting lists, quite frankly, have become so long that there's a lot of under-resourced services. But if we have more services like Heroes, which are set up around this sort of empowering lens of education, you do work through your issues with presence in the groups, but they're running a motivational coaching style, which is very different to traditional CBT, DBT.
What are some of the things that you'd want young people to take away from this podcast?
You're never alone with how you feel. Nothing you've done or who you are or how you feel is shameful. Please go gentle with yourself. If there's a part of you in pain telling you that you've not done good enough, or that you're bad or wrong or shameful, there are ways to learn to communicate with that part and become stronger for it. Recovery is always possible. Please have hope, and please make sure you get support if you need it. Educate yourself, be kind to yourself and others, because we're all connected.
Yeah.
Might sound a bit woo-woo, but it's the truth. We're all connected. We're not separate. Yeah, that's what I'd say.
Amazing. Well, Miranda, thank you so much for joining us today on our Youth Mental Health podcast. It's been incredible listening to you. And to our audience, please follow us and stay tuned for more.